Hello, welcome to all. So today we'll be discussing on introduction to drug interaction. So what is a drug interaction? So an interaction is said to occur when the effects of one drug are changed by the presence of another drug, herbal medicine, food, drink, or by some environmental chemical agents. So much more colorful and informal definitions by patients are that it is when medicines fight each other. So whenever the drug interaction happens, so most of the time we see the outcome as either the ADR or a toxicity or a side effect. So drug interactions, so the outcome can be harmful if the interaction cause an increase in the toxicity of the drug. For example, there is a considerable increase in the risk of severe muscle damage if patient on statin start to take a azole, any class of any drug of azole which belongs to the class of antifungals. Drug food interaction, patients taking monoamino oxidase inhibitors or antidepressants, which are antidepressants, MAOs in short, may experience an acute and a potential life-threatening hypertensive crisis if they eat tyramine-rich food such as cheese. So this is the best example for drug food interaction. These unwanted and unsought for interactions are adverse and undesirable, but they are other interactions that can be beneficial and valuable, such as deliberate co-prescription of antihypertensive drugs and diuretics in order to achieve antihypertensive effects, possibly not obtainable with either of the drugs alone. So whenever we will be planning a pharmacotherapy in hypertensive crisis or systemic hypertension, so we'll go with the dual therapy. So one will go with either ACE or ARBs. With addition to one of the antihypertensive drugs, we add diuretics in order to achieve the maximum control over the blood pressure of a patient who is suffering with systemic hypertension. So thereby it is a kind of a beneficial drug-drug interaction over which we can control the blood pressure of a patient. The mechanism of both types of interaction, whether adverse or beneficial, are often very similar, but adverse interactions are the focus of the clinical scenario. So whenever we'll see the adverse interactions, because they have a higher rate of mortality rather than compared to the beneficial reactions. So adverse interactions are such a kind of a bizarre reactions which can end up as a life-threatening scenario. So henceforth, clinically, adverse interactions are very much in focus. So what is an incidence of a drug interaction? The more drugs a patient takes, the greater the likelihood that an adverse reaction will occur. Example like polypharmacy, which will be having more than 4 drugs in a single prescription for a disease or a disorder. So in short, as the number of the drugs increases per day, there is a likelihood or the chances of drug interaction is very much. Mechanism of drug interaction. So the mechanism of drug interaction can be subdivided into two parts. One is pharmacokinetics of a drug and other one is pharmacodynamic. So pharmacokinetic interactions. So pharmacokinetic interactions are those that can affect the process by which drugs are absorbed, distributed, metabolized, excreted. In short, it is called as ADME interactions. The different types of pharmacokinetic interactions are as follows. So the first one is drug absorption interactions, second one is drug distribution interaction, third one is drug metabolism, fourth one is drug interaction. So pharmacodynamic interaction classification is one is additive or synergistic interactions, antagonist or opposing interactions, and the third one is drug or neurotransmitter uptake interaction. So, thank you. So in the further classes, we'll be studying about pharmacokinetic interactions.